Hello, welcome to Comcast Newsmakers, bringing you news and information from people making a difference in our communities. I'm Beverly Weaver, and joining me now is Paula Herzmark, the Executive Director of Denver Health Foundation. Welcome, Paula. Thanks for coming in.
Thank you for having me.
Let's begin. A lot of people may not realize the scope of what Denver Health does. We kind of view it as we hear Denver Health and think, oh, a hospital. But there's so much more to it.
Absolutely. I think that Denver Health is one of Denver's best kept secrets. I think that people have no idea that we take care of 1 in every 3 Denverites get their care in our system. 40% of Denver's kids get their care from Denver Health in our school-based clinics or in our neighborhood clinics or in the hospital. And so I think that people will be surprised to learn just how much of an impact we have in our community.
Yeah, and in terms of that, really the scope is so broad that you're even an academic hospital as well, which a lot of people, if they don't know that term, you're training new doctors, nurses, technicians,
that's right,
lab workers.
Every year we turn out about 3,500 different kinds of healthcare workers, from interns and residents to nurses and all kinds of technicians and people who work throughout the healthcare industry, and they get their training at Denver Health. We only get paid for training the residents and interns, but we train several thousand people in this industry every year, and are the only academic level 1 trauma center in the state of Colorado.
Right.
So yes, our training mission is a huge part of who we are and what we contribute to the community.
And who would you say you see, who is the average patient? You mentioned the 1 in 3 Denver residents getting their treatment there, and 40% of the Denver children. Who is it that you see? Is there a demographic that you would say is the typical patient?
We see large numbers of uninsured people. We have Medicaid patients, Medicare patients. We see CHIP patients. Most children are covered by something, and we see all of our kids are pretty much covered by either CHIP or Medicaid. We also have several centers of excellence in orthopedics, in people who have acute eating disorders. There are a number of areas where we specialize, and people come from all over the region, and in some cases from all over the country, to take advantage of the really superb and excellent physicians that we have at Denver Health.
And people may not realize also additional contributions are really necessary to keep these kinds of programs running. Why is it important for people to recognize that as a foundation you work to kind of do the back work to make sure the funding's there for these programs?
We receive government funds through Medicaid and CHIP and some of these kinds of things, and Medicare, but we see a tremendous number of people who have no insurance or who are underinsured and who need support. And so they are unable to pay, and I think something like 46% of our charges are unpaid. It's a very tough business model. And so when 46% of the invoices that you send out at the end of the month can't pay, you've got a tough situation. So the role of the foundation is to try to ease some of the pain of that, both for our patients and for the institution itself. So we raise money for things like our Patient Assistance Fund, which helps our patients to make co-pays, or if they need something special for when they go home from the hospital or something, we're able to support them with that. We also support all of our new families. We have a lot of babies at Denver Health, and we have a program called Newborns in Need, and we send every new baby home with all the necessities. And so we both raise money for our patients and for Denver Health itself.
And where can people go, Paula, to get more information on the foundation?
We have a great website, www.denverhealthfoundation.org.
All right. Paula Herzmark, the Executive Director of Denver Health Foundation, thanks for being with us.
Thank you.
And thanks for watching Comcast Newsmakers. I'm Beverly Weaver.